Hello and welcome back to my channel. My name is Marianne Jordan. I am a board certified trichologist and a cup and massage therapist. You may ask, what is a trichologist? Trichology means the scientific study of hair loss and scalp disorders. I attended the National Trichology Training Institute in Atlanta, Georgia to further my studies about hair loss and scalp disorder and scalp disease. So in today's video, we're going to talk about how anesthesia and surgery can have stress on the hair follicles. So as you know, or as you may have heard from someone that have gone through a surgery and have lost their hair, or may have had a tight and itchy scalp due to a surgery, some of the things that can happen when going through a surgery is that the anesthesia, the stress also from the surgery can cause trauma to the hair follicle. And the reason being is that when the surgery or the anesthesia is given prior to the surgery, and when a person is having surgery, it actually causes stress on the body. And due to it causing stress on the body, it causes the cell division to divide a lot of times. Now you may say, what happens when that occur? So let's just back up just a tad bit. So a lot of times when people are getting ready to have surgery, not all people, but they become stressed due to the unknown. A lot of times, people are scared when they're going through surgery. I know that I didn't go through a surgery when I had my children, but that was a trauma to my body. So even though, our hair grow so much more faster and we have the texture sometimes change when we are, going through the 9 months, the 8 or 9 months and are carrying our child, our hair does grow a lot more. That's because though we're taking a tad bit more iron, and our vitamins, we take more vitamins as well. Well, I guess I need to say the milligrams in the vitamins are higher. So, that's why our skin is so pretty. But then sometimes people's skin may turn dark when they are actually going through a pregnancy. But a lot of times the skin is pretty, the hair is growing, and, unless we're just going through a lot of stressful events when we are pregnant with a child or with twins or whatever the case may be, then of course, we have this natural glow and we have this beautiful hair. But when we get ready to have the baby, and after we have the baby, especially for 3 to 6 months, some people notice, and most women notice, that their hair tends to shed at an alarming rate a lot of times. That's because the body is going through a sense of trauma when we're having children. And that's the same thing that if you have any kind of surgery, and like I said, if you're receiving anesthesia and then the body starts going through these different stages, and it's really caused by cell division due to the anesthesia if you're going through a surgery, or due to having a baby or having babies, because some people, have twins and so forth. So that's when you start to see a lot of the hair growth. The hair loss. So let's go through a couple of steps so we can further understand the stages of hair. So, you have 3 different cycles that the hair go through. You have the anagen cycle, which is the growth cycle. And then you have the catagen cycle, which is the transitional cycle, which we also call the shedding cycle, where the hair sheds quite a bit. Especially, let's go back to what we're talking about when you're having a surgery or when you're going through a traumatic situation, because also you can go through when you're going through like a death of someone that you're very close to, like your mom, your brother, or your husband. And that could cause, trauma also to the body. So, but get back to what we're talking about. I don't want to jump around too much, and I definitely don't want to confuse you who may be viewing this video. So let's just stick with surgery. But those are some things that can cause trauma also to the hair follicles. But anyway, when we talk about surgery and when we talk about anesthesia, like I was saying, we was going through the cycles, which we got through the anagen cycle. Like I said, that's the growth cycle. That's a cycle you stay in a lot of times, the longest, or should. But then again, sometimes it could be some disruption, and then it just goes right into the last cycle. The last cycle is called the telogen cycle. So when you go through surgery, there is a hair loss, that is a medical name for hair loss when you're going through surgery. And that name is called telogen effluvium. So the third cycle that the hair goes through is called the resting cycle. And so when we're going through a surgery, or we're going through a traumatic event, our hair sometimes goes straight into the last cycle, which is the telogen cycle. And when it goes in the telogen cycle, which is the resting cycle, it's supposed to only stay in that cycle for a short amount of time. But there are times when that cycle is disrupted, it tends to stay there longer than it should. So that's when you start seeing a lot of the hair shedding. You might experience a tight scalp, a itchy scalp, and sometimes a burning scalp. And the other thing is that and when you're going through a traumatic cycle like that, a traumatic, surgery like that, and anesthesia, I'm sorry. But when you're going through something traumatic like that, it not only causes it causes the cells to divide. And once those cells divide, it cannot properly send messages to the other cells that it need to send those messages to. So if the messages are not getting sent to the cell, then the body is kind of confused and it doesn't know what to do. So instead of going from because your hair goes in cycles, so your cycle should continue, to keep going around instead of just standing at a standstill. But when it does stay in the resting stage, which is the telogen stage, too long, that can sometimes kickstart androgenetic hair loss. Androgenetic hair loss is what we talk about when we talk about our family members, or our mom or dad or both parents that may have experienced hair loss. And that's what you hear a lot of people talk about. Well, I lost my hair because my mom was bald, my dad was bald. Well, it has to be a predisposition that kickstarts you into the androgenetic hair loss. You just don't lose your hair because your parent or parents were bald. There is a predisposition. It could be stress. It could be medication. It could just be a number of things that can cause your hair to stay in that resting stage and go straight into the androgenetic hair loss. So what we want to do is we want to have some holistic remedies or solutions that we can sometimes use. And let me just go ahead and say this. Let me put this disclaimer in there. I am not a doctor. I am a board certified trichologist, but the information that I am giving in this YouTube video is just for educational purposes only. So I don't want you to just listen and view this video and, start doing some things that I may suggest in here, but you need to consult your doctor first, especially if you are on medication. And if you are not, consult your doctor or a health practitioner first before, starting any of the treatments or any of the solutions that I may suggest to you. Okay, so get back to that. So like I said, when you have cell division, I do have notes in front of me. So I'm going to try to look down, and because I want to give you the most informative information that I can give you so you can use. And hopefully that this right here will help you if you are going through any type of hair loss due to post-surgery, or if you're going through because of the anesthesia. And let me say this right here. When the body is, the cell division is disrupted like that, we try to do things to bring it back, to where it's supposed to be at. But also, we want to also keep in mind that the body takes 3 to 6 months to really get back balanced to where it was before it went through this right here trauma. So I'm going to look down at my notes, but these are some of the things that can happen when the cells are divided in reference to post-surgery or the anesthesia, or when both of them may be a cause of the cell division. So it says that, okay, we went through the cell division and we talked about how that happens. So now let's talk about what can happen when, when the cells are disrupted. Okay, So genetics. Genetic factors can influence the rate of cell division in the hair follicles and contribute to conditions such as male pattern baldness, female pattern hair loss. These conditions are often characterized by shortening of the androgen phase, and the androgen phase is the growth phase. So what it's saying is, instead of the hair going back to the growth stage, it shortens that cycle, and it stays in the resting stage too long. So that's when we start experience these different hair loss issues, male pattern baldness and female pattern hair loss. And it also says that by shortening the anagen phase and a gradual reduction of hair thickness and density over time. So I'm going to also give you some solutions that you may be able to use as well, whenever you are experiencing this, because we want to try to move it back into the androgen stage. We don't want it to stay in the third cycle too long, which is the resting cycle, the telogen cycle. So here are some other things that can happen, which some people may have noticed as well. Hormonal imbalance. And here's what it says about hormonal imbalance. It says hormonal fluctuations, such as those occurring during pregnancy, menopause, and thyroid disorders. Surgery can affect the hair growth cycle and lead to temporary or permanent hair loss by disrupting normal cell division in the hair follicles. So like I said, there it is again, disruption of the cell division. These are things that causes that. So when you're experiencing hair loss from, like I said, thyroid problems, hormonal imbalance, menopause, pregnancy, surgery, these are things that can cause the cell division, and that hair cycle stays right there. And the next thing, it says medical condition, which we've already talked about that, but I'm going to read what the information that I did pull up for you all, because I want you to be educated and informative about these issues, so you may know somebody that can use this information. It may not be for you, but let's just say we as women know we all can use it for menopause, because we all are going to go through that, which I'm already going through, and I'm 56, so yeah, I'm already experiencing that. But thank God that at the age of 56, I have not had any of the symptoms that they say that you will have when you're going through menopause. I really didn't know I was transitioning, with the exceptions that I no longer have a period, and that's it. But everything else, I have not experienced that at all. And I know that is to be because I keep my stress levels down. I make sure I stay out of stressful situations. I make sure that I take my vitamins, my minerals, my adaptogens. I drink my herbal teas. But the most important thing, I think, and now I don't know, but I think the most important thing that has kept me thus far off medication — I've never been on medication, no other than having a toothache, and I took some Tylenol because of the pain. But other than that, I'm not on any medication, because I know that stress of any sort, wherever it comes from, I know that plays a vital role in what happens to our body. So that's the one thing that we have to find an outlet for. We have to find an outlet, for hair loss issues, and that way, so we can live a more better and balanced life. Also, let's go ahead and continue with some more things that I have some notes for, and I hope you all are enjoying this. If you are enjoying it, please hit the like button. Please subscribe, so the algorithm, so I can bring you all more videos like this right here. But we're going to do our different things that's going to also be fun and lessen the stress that may be going on in your life. So the next thing is stress and environmental factors. So it says chronic stress, poor nutrition, exposure to environmental pollutions, and harsh hair treatments can also disrupt the hair growth cycle by affecting cell division and leading to hair loss. Okay, so let's talk about environmental. When we talk about environmental, that could be the pollutant that's in the air. That could be, the dust, the hair, the scalp, that skin just, I think that builds up on the scalp. Poor shampoo, not shampooing your hair properly, going 3 and 4 weeks without shampooing your hair, or at least doing a scalp cleanse on the scalp. So it could be a lot of different things environmental, but that can also cause, and the stuff that we're breathing in, the stuff that we take in, the smoke that's in the air, the smog that's in the air, the pesticides, the stuff that they spray in the air, all this right here. Let me give you one even close to home. Those nice candles that you light up in your house that are not soy candles, that are made with all these different ingredients, guess what? That right there could play a factor in cell division as well. So you want to start making sure that you are aware of candles that you're using, those sprays, those different sprays, those smell good sprays that you're using. You want to be aware of that. And you want to make sure that you are doing your detox every 90 days, or you could even do it every 6 months. I mean, I detox every 90 days, because I know all this stuff we breathe in and all this stuff we spray, and that you smell, that we need to do it, as often as possible. But I say I do 90 days, been doing it for the last 20 years. So it has definitely worked for me. But whatever your time frame is of your detoxing, make sure you get that done. So let's move along, because I want to keep this video under 20 minutes, hopefully. So, okay, so it says also, in summary, hair loss can occur when there is a disturbance in the normal process of cell division within the hair follicle, disrupting the natural hair growth cycle. Understanding the factors that influence hair loss and maintaining a healthy lifestyle, balanced diet, and proper hair care can help support optimal cell division in the hair follicles and promote healthy hair growth. So let me give you some solutions to this right here. So we're going to talk about genetic female parambolas. Here are some things that you can do that could help possibly with that. And let me say this as well while I'm thinking about it. As a trichologist, I myself and my business partner in India, Dr. Safaz, we do offer different solutions and treatments for people with hair loss and scalp disorders. It doesn't matter where you are. We can do virtual Zooms to be able to talk to you and do a virtual consultation with you to see if we can help you with your hair loss and your scalp disorders. We do offer compound holistic medical treatments, so we can mail that to you, and everything that we have, we can ship it to you. But I'm sure for whatever issues that you may have going on, that we have a solution for you. So let's go ahead and get this done, because it's got 17, so I got 3 minutes to get this done. So let's say genetic, you want to do scalp massages, and we also have blend herbal teas that we can mix together to accommodate whatever your hair loss issues are as well. And just remember that there are many names for different hair loss. So when you hear people say alopecia is just a medical name for hair loss. But what kind of hair loss? Do you have telogen? Do you have androgen effluvium hair loss? I mean, do you have frontal fibrosis? What hair loss do you have? So we cover that also in our consultation, our virtual consultation with you as well. And if you're in the surrounding counties, you can also, leave me a message or a comment in here, and we can get back in touch with you. And you can visit my website. I'm going to leave that in the description below. Okay, so also you can do herbal remedies. It says you can consider herbs and different herbal teas in order to be able to come back and help with genetic hair loss. And then we have hormonal imbalance. Here are some things that you can do. Balanced diet. And everything is going to always balance back to nutrition, because that's first and foremost. Hair loss is internal, not external, unless it's mechanical hair loss, where you are using too strong of a relaxer, or that hot comb is just too hot and you're burning out the hair. We also have medical conditions like alopecia areata, autoimmune disorder. Consult a healthcare provider for that, a trichologist and a dermatologist, and make sure that you are taking products that support your immune system. Stress and environmental factors. Healthy lifestyle. Adapt a healthy lifestyle that includes regular exercise, proper nutrition, and adequate sleep to reduce the impact of stress on the hair health. Natural hair care. Try to use as many natural hair care products as you possibly can. And also scalp care. Scalp care. Maintain a clean and healthy scalp by gently cleansing and exfoliating to promote optimal condition for hair growth. The last one, nutritional deficiency. A lot of times, do you know that you can have hair loss due to a vitamin D deficiency? Yes, ma'am. Yes, sir. You can lose your hair or you can have hair loss due to a deficiency. When we get a certain age, our body starts to kind of slack or slow down at producing the amount of vitamins and when our body starts to get older, let me change that. We need to make sure that we are taking, you should always take your vitamins and minerals. But when we get a certain age, you want to definitely make sure that you are taking the right vitamin for you, the right mineral, amino acid, drinking plenty of water, hydrate your cells. Those are things you definitely want to do. And let me throw this in to you as well. One thing that I do every morning before I drink anything, I drink coconut water. Coconut water has a wealth of benefits. I'm going to cover that in the next video. But do your homework on coconut water. If you decide to start drinking a coconut water, come back, visit this YouTube video and let me know what you think about it. But Google, you will find, you'll be amazed that it lowers cholesterol. It sure does. So let me read this last one. This is nutritional deficiency. Supplements. Consider supplements like biotin, iron, zinc, and vitamin D after consulting with a healthcare provider to address specific nutritional deficiency that may be contributing to hair loss. A balanced diet. Emphasize a nutrition-dense diet rich in fruits, vegetables, and lean protein and whole grains to support overall health and promote healthy hair growth. So those are some things that I have given you. Rewind this video and just as much as possible. It is my prayer that I have said something in this video that will help you in your day-to-day journey, and if you are struggling with hair loss, please get in contact with me. My website will be on the bottom. There's a wealth of information in that. You can also find me on YouTube at RoyalParadiseHairLossCenter.com. I have a lot of videos also on my website and on my Facebook page. But I'm going to try to stick to doing more videos. Look at my previous videos. I kind of got away for a while due to just doing a lot with different businesses. But now I am back and I want to be able to at least upload one video every week, if not two, but for sure one video that I think there will be videos that you can use or maybe family members, friends, or co-workers can use. But until the next video, thank you. And please do not forget to comment on this video. Let me know what you all want to hear. Let me know some of the issues that you have gone through. And also tell me, what did you do to resolve the issues if it's dealing with your hair loss or just your scalp? I mean, everybody has had scalp problems. So I would love to hear that so I can read about it. I believe in doing research. And like I say, just let me know videos that you would love to hear about. My next video is going to be about coconut water and how it benefits our hair follicles. But until next video, I want to say thank you for viewing this video. And please share this video. There are so many people that can use this information. So thank you. And until next video, I am Marianne Jordan, your board certified trichologist and your certified cosmetologist, as well as massage therapy. So make sure you drink plenty of water, stay stress-free, and know that you are the winner of your own household. Don't let nobody take that from you. You are that girl. You are that guy. And remember that. You always win. Your purpose on this earth is to win, and you will win. So until next video, I love you all, even though I don't know you all. Take care.